Two cases of the Marbug virus disease, a hemorrhagic fever almost as deadly as Ebola, have been recorded in Ghana, the first ever in the country, health authorities announced on Sunday. On July 8th, blood samples from two people in the southern Ashanti region suggested the Marbug virus, and the samples had been sent to the Pasteur Institute in Dakar for confirmation, the Ghana Health Service said. The 98 people identified as contact cases are currently under quarantine, the statement added, noting that no other Marbug cases have been detected among them so far. Health authorities say they are doing everything possible to protect the health of the population, calling for the cooperation of all to ensure that the virus is effectively contained. The Marbug virus disease is transmitted to humans by fruit bats and is spread in humans through direct contact with the body fluids of infected people or with surfaces and materials, according to the World Health Organization. The World Health Organization announced in September 2021 the end of the first episode of Marbug virus in West Africa, 42 days after the identification of a single case in Guinea. Sporadic outbreaks and cases had previously been reported elsewhere in Africa, including Angola, Kenya, Uganda, South Africa, and the Democratic Republic of Congo. The onset of the disease is sudden, with high fever, severe headache, and eventual malaise. Case fatality rates have ranged from 24% to 88% in previous outbreaks, depending on the virus strain and case management, according to the World Health Organization. Although there are no approved vaccines or antiviral treatments for the virus, oral and intravenous rehydration and treatment of specific symptoms improve survival rates. The death toll from days of tribal clashes in southern Sudanese province climbed to at least 65 people. The fighting between the Hausa and Bata ethnic groups in the Blue Nile province also injured around 150 others, said Gamal Nasser Al-Said, the province's health minister. He told the Associated Press that most of the dead were young men who were shot or stabbed. Al-Said urged authorities in the capital, Khartoum, to help airlift 15 seriously injured, as hospitals in the Blue Nile lack advanced equipment and life-saving medicine. The fighting in the Blue Nile grew out of the killing of a farmer earlier last week and continued through Saturday, according to the local government. Authorities deployed the military and paramilitary rapid support forces to bring stability to the region. They also imposed a nightly curfew and banned gatherings in towns of Rosay and Damazin, where the clashes took place. Local media reported that thousands of people fled their homes since the clashes began last week. The fighting was the latest tribal violence to hit Sudan, which is in turmoil since the military took over in a coup in October